Bring the people in. Are you enabling the waiting room?
All right. Welcome. Thank you all for joining us for the Health Equity Forum, March 2024. Just a couple of reminders. This is a meeting that is being recorded. If you're joining us online, please remember to mute your microphone so that we avoid any background distractions. And please use the chat feature if you have any questions, comments, or reactions to what we're talking about today. If you prefer to speak out loud rather than chat, just use the raise hand icon and we will get with you as soon as we can. We encourage your reactions to what's going on here in the forum. And I will go ahead and turn it over to my colleague, Karina Limerick.
Thank you so much, Wendy. Greetings, everyone. I know that spring break season is in the air. So for those of you who are joining us in person or online, welcome. We appreciate your giving us your time. And we are really excited about today's forum. My name is Karina Limerick. I am the program manager for the Health Equity and Racial Justice Office. And I'm thrilled to rejoin you today during this forum. I want to just thank my colleagues, not only in the Health Equity and Racial Justice Office, but in other areas across the Department of Health for implementing a stellar forum last month during my absence. So today's forum will center on Department of Health and community-based health initiatives and events. But before we get started, I'd like to shine a spotlight on Women's History Month. Each year, March is set aside as a time to honor the contributions of women to America's history. This special designation is by presidential proclamation. And as this month draws to a close, there are two events right here in Anne Arundel County that will center on the theme of this year, which is celebrating women who advocate for equity, diversity, and inclusion. So the first event is the 6th annual Michelle Obama Awards. 14 incredible women will be honored this month during the award ceremony, and Prince George's County Executive Angela Alsobrooks will serve as the keynote speaker. The other event occurs tomorrow. It is hosted by Anne Arundel County Office of Equity and Human Rights. And the conversation will center on pay disparities between men and women. The director of the office, Asha Smith, will serve as the moderator of this discussion. And I encourage your participation. You can scan the QR code or access the link to get all of the details for these two pivotal events happening right here in our county. At this time, I'd like to turn your attention to Raymond, who will introduce our next speaker.
So we have some exciting things happening in our county right now. One of the people leading it is Theron Abel. So he'll be sharing about the health vending machines that's happening all around the county. Theron?
Hello, good afternoon, everybody. My name is Theron Abel. I'm the Overdose Response Program Coordinator for the Anne Arundel County Department of Health. In short, I handle all things Narcan, Narcan accessories, and naloxone education. But more importantly, I'm here to share with you all the biggest initiative that we've been working through with the Department of Behavioral Health, and these are our Health to Go vending machines. I'd love to go ahead and tell you more about what this program is and where you can find it. Next slide, please. All right. So we are coming from a background of harm reduction. For those of you who are unfamiliar with harm reduction, you may be surprised that you already are. Harm reduction can be narrowed down to a set of strategies aimed to just reduce negative consequences of anything. And in our case, when it comes to Narcan, of course, we want to associate that with drug use and minimizing the negative effects of drug use. But this can be as something as simple as a seatbelt or sunscreen or things that we do every single day to reduce the negative effects of things that we do every day. It's a movement that we believe in that meets people where they are and aims for the power of just any positive change. And some of the main examples that we'll be covering today are Narcan, otherwise known as naloxone hydrochloride, the main drug used to reverse overdoses in our community. Next slide, please. We recognized that within our county, there was a long-standing issue when it comes to overdoses and overdose rates throughout our county. We know that since the year 2021, our numbers have quite stabilized. It was tumultuous going up and down from 2018, 2019, but we finally stabilized in 2021, and we are aiming to just keep it down and continue to push it down. We know that fentanyl is starting to be the leading drug when it comes to illicit adulterants in the drug supply, but there's also a new drug that we're keeping our eye on called xylazine, which is a very veterinary sedative for bovine animals that pairs with fentanyl due to its shortened high of since fentanyl is entirely synthetic, the high of fentanyl is getting shorter and shorter, and xylazine aims to aid with that. Just and how they're paired. But we do look to the vending machines as a low barrier opportunity to help people get in touch with harm reduction materials like naloxone, making sure that anyone can be anonymous and get the materials they need, no matter if they are or are not a drug user. Next slide, please. We have launched 7 vending machines throughout Anne Arundel County. And as you can see, they're scattered all throughout the map. We wanted to make sure that these vending machines were in areas that we know are able to reach people with. We were intentional when it comes to the highest risk of overdoses and the highest concentration of overdoses. So our areas can be broken down fairly simply. We have 2 libraries. We're going to be featured in the Brooklyn Park Library and the Deal Community Library. We have 2 different community centers, being the Eastport Community Center and the Severn Intergenerational Center. We have 2 detention centers, being Jennifer Road and Ordnance Road. And for those who are already there, over there at HSB, there's one over at the Health Services Building in Annapolis. And feel free to take a closer look at the county guide. We aimed for the historically highest rates of overdoses in the red areas, and we seem to hit those areas fairly well with the placement of the vending machines. Next slide, please. So as I was mentioning earlier, harm reduction really helps us throughout this endeavor. We want to make sure that people are getting prime access to the care that they need. And with our department, I work through the harm reduction team over at the Department of Health. We already have programs and services that are in that harm reduction space. So we look to the Wellmobile to provide low barrier buprenorphine access, as well as other certain service programs, and or even our own in-house AA Power team, who we work incredibly close with, talking with volunteers and people who are in the community who are current active drug users. We hold overdose prevention trainings and other peer support. And we know that our vending machines are going to be the next big branch in that area. Next slide, please. Here are some pictures that we have. I believe the slide will go through on and on. Tracy and I went through very early February and installed a few machines it was an absolute blast getting to touch base with people in the community. I remember we were at Jennifer Road Detention Center, and there was an individual who was already asking for a mask out of the machine, just going to prove that there is a need for this sort of, initiative. I'm not sure if if the pictures are rolling, but you can go to the next slide as well. We know that I keep saying low barrier, but what we're going to capitalize on as well is making sure that other people in our community are also reaching out to peers who are people who are using the vending machines. So at our detention center locations, we know that our Road to Recovery and peer support teams will be there to help and ask questions about what's available. Our Wellmobile staff will be available at the Severn Intergenerational Center, and our Department of Health Harm Reduction staff will also be there at the Deal and Brooklyn Park libraries. There will be a QR code on the side of all vending machines for people to include on just the side so they can scan and ask if there's like low stock, or someone can just go up, scan with their phone and say, hey, this machine's running low on Narcan. Can you please come by and fill it out? It's a great centralized map to help individuals get the materials that they need. Next slide, please. I keep talking about these vending machines, but what's in them? We know first and foremost that the main object that will be in these vending machines are going to be our Narcan kits. So each kit comes with one box of Narcan. It'll have a pair of gloves, a mouth shield, and an instructional brochure on how to respond to an overdose. And that's all in one nice little contained kit. We also offer fentanyl and xylazine test strips for individuals who are concerned about the absence or presence of fentanyl and xylazine in their drug supply. We're also offering COVID-19 test kits and KN95 masks for the individual's everyday use. And these are some of the harm reduction materials that folks may be already familiar with, but haven't quite put the two and two together. At our detention centers, we are offering safe sex kits. So we're offering condoms of both sexes, lubricant, dental dams, and other resource cards for individuals who are looking for more resources than we can provide. And we are aiming to stock these machines twice a month. I've already restocked the machines. I think I've done 5 restocks at individual locations. So they've been incredibly successful so far. We've heard nothing but great feedback. Next slide, please. Yes, for those of you who were in the building around March 11th over there at the Health Services building, we had our press release. It was very fun going home and telling my mom, like, oh, look, I was on the news. Like, I was on the news. And you can just see my hands. I got Mike Wazowski, as I like to say. But the outreach has been overwhelmingly positive. One instance I can speak to is that early on when we installed our detention center machines, we had an individual who was transferring in from Baltimore City and overdosed. The guard used the Narcan that was at their station to help the individual, but once they needed more, they ran down to the vending machine, got more Narcan, and saved the individual's life. And the person is now in stable condition. And if that isn't a telling story of how these machines are so needed, I wish I could have another one for you. But in the event there are any comments, questions, concerns, queries, kumquats, please feel free to reach out to me. My email is right here, hdable23. You can also contact our sorting service program, AA Power, and field any questions that you may have. And I am more than happy to share this with you all. Thank you all so much for having me on.
Thank you so much, Theron. One of the questions was, and I believe was answered inside of the chat, was where can there be information about the different locations? And then Sandy also put in the chat the links to the behavioral website, where we also will be able to share out with all the partners in our follow-up email.
Oh, perfect. Sandy, I didn't even see you were on this. Thank you so much for having me. Sandy's been an incredible help through this entire endeavor. Couldn't speak to her higher. Let's see, are there any flyers? There will be flyers. Each machine will be coming with a literature rack as well. The machines are already in place at their locations, but there will be literature racks on the side of them for flyers for further resources, information on the materials, and where to go from there.
Awesome. And once again, if you have any other questions or any other thoughts, you can be able to email Theron directly, or you can also email us at our AA Health Equity at aacounty.org. So thank you so much, Theron, and great job and the great work that you're doing in our county. Unsung hero. Thank you, sir.
Thank you.
Okay. As you know, we move to our next slide, that March is Colorectal Awareness Month. It's been designated as Colorectal Awareness Month since the year 2000. Typically, the color is blue. So we're going to have Christine Bloom. She's just going to share a little bit about colorectal awareness and just be able to bring that education to our community. Christine?
Hi, everybody. Thank you for having me. My apologies. The person you're seeing live looks a little older than the person in the picture on the slide. I realize it's time for a new headshot. Yep, as Raymond said, I'm Christine Bloom. I'm the program manager with the Chronic Disease Prevention Program in the Bureau of Disease Prevention and Management. And we're still in March. March is Colorectal Cancer Awareness Month. And I'm just going to talk briefly about what colorectal cancer is and what we can kind of do about it. Next slide. So colorectal cancer is a type of cancer that arises in the colon or rectum, and those are parts of our large intestines. Sometimes abnormal growths develop and they're called polyps. And over time, the polyps may become cancerous. Next slide. Signs and symptoms of colorectal cancer. Some are listed here, but many times people can have no signs and symptoms in early stages. That's why it's so important to note these signs and symptoms: a change in bowel habits, blood in or on your stool, diarrhea, constipation, a feeling that your bowel is full, some abdominal pain, cramping, and some unexplained weight loss. These are all things that you'll want to speak to your healthcare provider about. Next slide. This gets a little clinical, but there's a little bit of good news about risks for colon cancer. Many, and in fact, most, we can affect. So on the left side of the screen, there's listed risk factors for cancer that cannot be modified or changed. And those are things like getting older, having some kind of inflammatory bowel disease, having a personal family history of colon cancer or polyps. And then there's several genetic symptoms that are, the first one, a familial adenomatosis polyposis, is a very rare condition that predisposes some folks to cancer. And the second one is a genetic mutation. So we don't usually hear about those. But again, the good news is many risk factors we can modify or change. And those are things of like lack of regular physical activity, diets that are low in fruits and vegetables, low fiber diets. I mean, all this we've heard, and they're not just good, nutrition and lifestyle factors to mind for reducing our colorectal cancer risk, but for all cancers and in general, good health. So we want to monitor overweight and obesity, alcohol consumption, and tobacco use. I think this is interesting. The little asterisk there is that according to the American Cancer Society, 55% of colorectal cancers in the US are attributable to these like risk factors that we can change. Next slide. We talked a little bit about in the previous slide about how we can prevent colon cancer. And one of the most important things we're going to do is get screened after the age of 45. Mostly the colorectal cancer develops from abnormal growths called polyps in the colon or rectum. And when they're removed early, we can avoid colorectal cancer. Next slide. So what is colorectal screening? There's primarily 3 screening tools that we use, and it's now recommended that everybody 45 years and older talk to their healthcare provider about having one of these screening tools. Stool testing, a sigmoidoscopy, and colonoscopy. Next slide. These are just a few statistics from the Maryland, uh, this is from the Maryland Department of Health and the American Cancer Society. So among women in Maryland, it's the third leading cause of cancer-related deaths. And among men, it's also a third leading cause. I thought this statistic that the American Cancer Society estimates that in 2024 in Maryland, 2,620 Marylanders will be diagnosed with colorectal cancer, and about 1,000 Marylanders will die of the disease. The next slide will show us that, go ahead, we can move to the next slide. The next slide shows that Anne Arundel County's data is pretty much in line with the US data and Maryland state data. This is from our Health Department Report Card 2022. As we all know now, data lags a little bit. So this is 2014 to 18 data. And you can see colorectal cancers there. Anne Arundel County is the dark teal, and then Maryland is that little bit of a lighter teal color there. We're pretty much in line with incidence and mortality or death rates from the cancer. Next slide, please. So if you're interested in screening, if you're over 45, I hope you are, please talk to your healthcare provider. And I wanted everyone to have contact information here for our cancer screening services program. There's a phone number there. For those of you that are driving or can't see me, it's 410-222-7979. And on aahealth.org, our county health department website, under colorectal cancer, there's information there about screening. We do not have an in-house case management and screening program for colorectal center. We refer folks to MedStar Harbor Hospital, which is, right over the Brooklyn Park, Anne Arundel County, Baltimore City line. But they have a program there for folks that qualify for financial reasons or, lack of health insurance. That's it. Thank you.
Thank you so much, Christine. Are there any other questions or any comments anybody would like to share briefly? We'll be sending a follow-up email. We just put the number in the chat for anybody who didn't get a chance to, so you can have that number. So we did put that in the chat. And once again, it'll also be sent out on follow-ups. And thank you again, Christine, for the great work you're doing, and especially putting that the message is so important, especially when we start to hear those rates for our county. So thank you again. So next we have Peggy Cruz of our Director of Family Services, and then we'll be sharing just a little bit about some initiatives that are going on in our county related to infant mortality health.
Hi, good afternoon, everybody. As Raymond has mentioned, my name is Peggy Cruz, and I'm working here with the Directorate of Family Health Services at the Anne Arundel County Department of Health. Just want to share with you a little bit about an initiative that we have going on in the health department. It's the Maternal and Infant Health Task Force. If we could go to the next slide, thank you. Okay, so we put together this Maternal and Infant Health Task Force that's being co-chaired by our stellar health officer, Dr. Tony Gedden, and the equally stellar Monica Jones from Luminous Health. We formed this task force in November of 23 with the express purpose of making pregnancy and childbirth safer. I'm going to show you a little video in the next slide so that we can kind of set a level here. So if you can move to the next slide, please, and hit the play button.
Black women are 3 times more likely to die from a pregnancy-related death than white women. I was almost one of them. When I was pregnant with my son, the warning signs were there, but I wasn't seen or heard. 1 week after having my son, I had a stroke. Yes. Let's empower Black mothers, promote health, and connect women to services that help build support. If you're pregnant, don't be afraid to make your voice heard. It will cost nothing, but could save everything.
Okay, thank you.
Black women are
Okay, thank you. So in the PSA that you just saw, you were introduced to a lady named Chanel who had what I think is a devastating health scare after the birth of her baby. So in the last few days of her pregnancy, she experienced complications like swelling, high blood pressure, and rapid weight gain, all of which she brought to her doctor, but they were dismissed as unimportant. She was basically told to go back home and wait it out. So a week after her delivery, she was home and suddenly became unwell. When her family rushed her to the hospital, the doctors were minimizing her symptoms still until her mother, who is a nurse, insisted that she be evaluated for a possible stroke. Well, lo and behold, that's exactly what was going on, to the point where she had to have 2 brain surgeries to mitigate the damage that was brought on by the stroke that she was having. So one has to then wonder if any early interventions when she was initially experiencing any of those symptoms in her late pregnancy could have prevented the stroke. Why were her symptoms ignored? And as she asks herself, why was she not heard? So these kinds of instances are what the task force is hoping to address in raising awareness about the maternal health statistics that are affecting women, and Black women in particular, because Black women are more likely to have adverse effects from pregnancy-related complications, regardless of their education, regardless of their income level and their access to care. Next slide, please. I do want to tell you a little bit about the task force. It's in collaboration with partners from area hospitals, practitioners from the community, and stakeholders who work in the space of infant and maternal health, like doulas, nurse midwives, social workers. We basically gather to discuss what causes poor health outcomes in mothers and for their babies, and what we can do to turn the curve on those outcomes. Let's do. So the role of the task force is to study what's going on. We take a look at what the data is showing, what's going on, and what we can provide oversight on and make recommendations on for best practices to elicit better health outcomes for birthing people. So we want to essentially elevate maternal health as a priority to improve maternal morbidity, infant morbidity, and all the indicators that cause mortality in mothers and their babies. Next slide, please. So the task force is hoping to do a few things. We convene our partners to share data, to identify opportunities to cooperate, to coordinate our efforts, and to increase efficiency. Essentially, there's really no need to make anyone reinvent any wheels if we don't have to. So we would like to develop a strategic plan to address the needs assessment and the community priorities that we've identified, and create communication so that we can engage with the high-risk populations, because it does no one any good if we gather all this information, talk about it, and then just sit on it and keep the information to ourselves. So also something else that we would like to do is to track goals and performance measures to identify opportunities for improvement in the process and in the system. So if we can do those things, we think that we can contribute positively to the statewide strategies to reduce maternal morbidities and to improve prenatal care. Next slide, please. Thank you. I'm going to introduce you now to Bella Young. She is the special assistant to Health Officer Dr. Gedden, and she's going to take us through some explanations about asset mapping and talk a little bit about our timeline. Bella, thank you.
Sure. Thank you, Peggy, and good afternoon, everyone. So as Peggy noted, the aims of the task force are to support women, particularly pregnant women and recent mothers in the county. Our overall target population are these individuals, these pregnant women and recent mothers, particularly women of color, their children, and their support networks. And so what we're working on right now, since the launch of the task force, is going through that strategic planning process. And so trying to understand where the disparities are and what's going on in our county. And so we're doing that by looking at our data and looking at the quantitative information that we have. Also looking to all of the partners and organizations that are on the task force, what they're seeing and what they're hearing from these populations about what their concerns are and what their needs are. And we're working on building out a map of all of our resources, both what we have and what we don't have. So we've worked through what our assets are. We've taken a look at all of the programs and all of the people who are our strengths and our opportunities to make a difference. And then also taking a look at where are we lacking? Where are we not reaching these target populations? Where is there a lack of access to care? Where's just an overall gap between what we offer and what we want to be offering, or where we want to be, and the difference between that is our gaps. And so right now we're working on brainstorming those, and those will inform what the priorities and what the strategies will be for the task force moving forward. So we make sure that we really systematically build out programs and provide resources to the population to really make an impact on these health indicators. And you can go to the next slide. This gives just a timeline of where we've come from as a task force and where we're headed. So as I noted, and as Peggy noted, we kicked off in November. We went through assets and strengths of the county, working through a needs assessment and that gap analysis, and also working on making sure that our data is accessible and available, not just to our partners, but to others who may want that information. And so making that available on a data dashboard. And then something else that's coming up, I've talked a lot about how we've referenced the data, but something that has been really important to the task force since we got started is ensuring that we have the voices of these women and their support networks a part of this. We want to hear from them what their concerns and their needs are. So we really make sure that the work that we're doing is addressing what the community's concerns are. And so we're really excited to be hosting a series of listening sessions kicking off next month to be able to incorporate those voices into our planning and into our work. And you can go to the next slide. So speaking of those sessions, I'm going to share a little bit more about those community listening sessions. You can go again to the next slide. So the health department is hosting these community listening sessions to understand how to better support new moms and moms to be in our county. So we want to hear from Black women and their loved ones and their support networks, these women who are expecting or who have given birth recently in our county, so both pregnant women and new moms. And then noting there are a couple of those statistics that Peggy noted. Part of the reason for focusing on this population and on this issue is that we know that the maternal mortality rate is 1.6 times higher for Black women than for white women in Maryland. And the infant mortality rate is 2.6 times higher for Black infants than for white infants in our county. And so clearly there is a disparity here. And so we want to hear from these women and their families and their loved ones to know what's going on, what their experiences were, where there might be opportunities to better support them in the future. And if you go to the last slide in our deck, that has information about the listening sessions, and we can share the website for where to go to share this out and to spread the word. Just as a heads up, attendees of the sessions will receive a meal. We have giveaways, so we're doing a bundle of new mom care items, all sorts of perinatal resources and information. And then, of course, the opportunity to be a part of the county's solutions to this issue. And so highly encourage, if there's anyone that comes to mind who you think would be a good person to have at these listening sessions, please do share this out or share this out in your networks. Those will be kicking off starting April 3rd. So we're really looking forward to that starting up.
Thank you so much, Bella, and thank you so much, Peggy. Are there any questions, any thoughts, any comments? We've recently done some equity-focused small groups, and inside of those equity-focused small groups, there's definitely a lot of need from young moms or young adult moms who are very much focused. So I think these listening sessions are going to be very dynamic and thought-provoking, and it's very much needed in our county so they have a voice. So I think that's a great initiative. And also I see that Kia had her hand up.
Hi, everybody. I'm Kaya. Isabella and Peggy, I'm with Luminous Health, and we're actually having a community baby shower on June 1st. So I would love to get one of you guys' contacts. We could talk further about possibly partnering if that's an option.
Absolutely. So if you go to the chat right now, Raymond put my email address there.
Sounds
And I'll await a message from you.
Okay, sounds good. Thank you, Peggy.
Thank you.
Awesome. Thank you both. And once again, I think it's going to be very dynamic. Thank you for that work, and thank you for pushing that information forward. We're going to move on. We have Donna Perkins. She's the director of the Office of OAP, and she'll just share us some legislations connected to maternal health.
Yep. Thanks. Hello, everybody. Just go right on to the next slide. This will be really short and sweet. But one thing we wanted to bring to your attention is that we know that there are, in addition to all the wonderful work that Peggy and Bella and the team are doing, there's also an opportunity to make sure that our underlying structures and systems are doing what they need to be doing. And part of the way we do that is through legislation. So right now, there is a bill being considered through the Maryland General Assembly. It's both in the House and in the Senate, and the title of it is right there, HB 1051 and SB, which stands for Senate 1059. And this is the Maternal Health Act of 2024. So why is this important? Well, so it requires providers to complete a prenatal risk assessment during the initial visit of a pregnant patient, and then that assessment comes to the health department. It also, for high-risk pregnancies, requires hospitals and birthing centers to complete a postpartum infant and maternal referral form. And again, that would come to your local health department. So here it would be Anne Arundel County Department of Health. It also requires the hospitals and birthing centers to provide information and resources to the birthing parent about postpartum complications, and also requires them to call the birth parent between 24 and 48 hours after discharge to, excuse me, evaluate their status. So there's a responsibility there for our providers and for our hospitals. I do want to say many of our providers and hospitals already do this, but it's really important to make sure that this is put into law, because then that makes it a requirement across the board and helps to make sure that it's being applied uniformly to all of our birthing parents. It also requires the Maryland Department of Health, our state health department, to develop a prenatal risk assessment and establish a process to submit it electronically. So there's already a prenatal risk assessment that exists, but it is dated. It really needs to be updated, and it needs to be in a way that makes it easy for providers to get that information to the local health department as quickly as possible. So this is an opportunity for us to push forward into the modern age of using electronic submissions for these risk assessments. It also requires the Maryland Department of Health to develop a report card for birthing facility maternity care. And that includes how babies are being delivered, what type of complications that they're seeing, and also requires to include qualitative measures based on patient input. So the information that we're gathering now from our birthing moms who have stories to tell, this is another way that can be codified into law and a requirement for our different birthing facilities. It also, again, has a role for the local health department, for us, to receive those prenatal risk assessment and referral forms. And then what we do is we have to report back to the Maryland Department of Health about the number and types of referrals that we made based upon those assessment and forms received. So good news, this bill has been moving along pretty smoothly and has passed in both the House and the Senate on their separate bills. They now take those bills and swap it between the two chambers so that they can make sure they're all on the same page. But we're very hopeful that this bill is going to move forward and be signed into law, and again, help just make sure that those underlying systems and processes are in place to protect our birthing parents in the state. And that is it for me. Thank you for letting me do my legislation spotlight.
Thank you, Donna, for the work that you and Kristen are doing with legislation and keeping us updated about the things that are going on behind the scenes. So thank you so much. If there are any questions, it's just an opportunity here. If not, we have the email inside the chat where you can be able to email us, and we'll get back to you on any questions or concerns you may have concerning maternal health legislation. Okay, if not, we'll go to the next slide. So we have Kaya Vaughn. She's from Luminous Health, and she's the health and education specialist. So Kaya, if you mind sharing.
Hi, everybody. First, I want to say I apologize. I'm just getting over a cold, so if I sound a little congested, that is But yeah, I am the community health and education specialist with Luminous Health. And I'm just gonna tell you a little bit about what we do in the community improvement department. Go to the next slide. And the next one. Thank you. So those of you who don't know about Luminous Health, we are a nonprofit regional health system. We were formed in 2019 when Doctors Community Medical Center and Anne Arundel Medical Center merged. And we provide care for about 1.8 million people in Anne Arundel, PG County, Eastern Shore, Talbot County. You can go to the next slide. And this is just a quick timeline of Luminous Health. You probably can't see it because it's small, but right in 2019, just how I reiterated it, that's when Luminous Health was created. You can go to the next slide. Okay, so this is Luminous Health's mission, vision, and values, but I highlighted where the Community Health Improvements Department aligns with those values. So our mission is living healthier together, and we believe that health and wellness are fundamental to everyone. Our vision is to enhance the health of people in the communities that we serve, and our values are to provide respect, inclusion, service, and excellence. You can go to the next slide. All righty. So one main thing I want to point out here under our strategies, the main thing that we do here in the Community Health Improvement Department is provide outreach and screenings. You can go ahead to the next slide. And some ways that we do that through our core functions is to assess the community needs. I'll go into detail about how we target those communities through social determinants of health. But we also partner with different organizations, different nonprofits in the area that are providing resources that we don't provide or that will be an asset to the communities that we serve. You can go ahead to the next slide. A little bit about what we do. We provide free healthcare services, and we target communities, like I said, that are impacted by the social determinants of health, which I will talk about on the next slide. So our services include diabetes screening. So we do A1C and glucose screenings, cholesterol. So this is their total cholesterol screening that we're doing. Blood pressure screenings, health education. So we do diabetes and hypertension workshops. We also have a diabetes prevention program, which I'm really excited about. We actually target communities within Luminous Health for people who fall within the pre-diabetes range based on their last A1C reading or screening reading. And it's a program, about an 8-month-long program that we go through to prevent them from developing into getting diabetes. So it's a really good program, something very personal to me. My mom, about 10 years ago, was told that she was pre-diabetic. And without changing her diet, not really having a plan on how to change those diets and those skills, she ended up getting diabetes. So I'm really passionate about this program because I think it's really helpful to the communities to provide a plan for them. And lastly, health education resources. We provide different resources in the areas of the communities that we're in, whether we're in PG County or Anne Arundel County, where we will be sending them like low rates on different health services or health organizations, things like that. The different resources for like cholesterol resources, if we do see that they have a high cholesterol, giving them resources about that or any other screenings that we do. So you can go ahead to the next slide. And I just wanted to talk a little bit about the social determinants of health. So education, access, and quality, healthcare and quality, neighborhood environment, social and community context, and economic stability. These are 5 determinants of health that we really want to target based on the communities. So some definitions of those or some things that will fall underneath those categories are employment, the income, if they're not employed, do they have health insurance? Would that be a resource that they would need based on the communities that we're serving? Literacy, different health literacy. Parks, do they live in an area where they're able to get exercise outside, they're able to walk around? Transportation, if they do have health insurance, are they able to get to those resources? So really accessing our communities and seeing what the need is under these categories so that we can better help serve those communities the best we can. Go to the next slide. And our service areas, sort of like what I mentioned before, we are in Anne Arundel, Prince George's County, and Queen Anne counties. In some places that we do have events, we go to low-income apartments, faith-based organizations, based organizations, nonprofit organizations, schools, senior centers, and things of that nature. You can go to the next slide. And we can do that two ways. We can come on site depending on where the event is, if you would like us to come out, or we have our own mobile van that we can do all of our screenings on. We have two exam rooms that we have for privacy for our patients. But those are two ways that we provide our screenings. You can go to the next slide. And I have some of the upcoming events for PG County and Anne Arundel County listed here. If you want to know more about where we will be, I can send out, you can email me. I provided my email. I believe they put it in the chat. Feel free to email me and I can send you an up-to-date list or flyer of our upcoming events and where we'll be. You can go to the next slide. And these are our events in Anne Arundel County as well. And you can go to the next slide, please. This is just our flyer. If you all like, I can put a link to our flyer if that'll be helpful for you all. I can do that after. You can go to the next slide. And if you would like to partner with us, here is the QR link right here. You can also select the community outreach form by right-clicking and it'll take you right to our outreach form. But I thank you all for your time. And if you have any questions, please let me know.
Thank you so much, Kaya. And we've also put inside of the chat the link to the outreach request form and the email, so you can give her great work. And I also just give her kudos. One of our partners was looking for some immediate help, so she sprung into action and helped them out immediately. So that's just already a great partnership. So just like to thank you on behalf of our health ambassadors and thank you on behalf of our Office of Health Equity. So thank you so much.
Thank you.
Awesome. And speaking about our health ambassador partners, we have an opportunity just to share some of the work that they'll be doing in our county with some upcoming events. So we're just going to highlight a few partners. We have a lot of great partners and they're doing a lot of great work across the county, but we just have some partners who have some larger scale events that they're planning that are around the corner. So we're going to start with My Life Foundation, and they're just going to share a little bit about the Korean Resource Day.
Yes, hi, my name is Grace from My Life Foundation. We have program resource for May the 18th. And we had a last year, about 1,200 visitors came. And this year we're looking forward to see more folks because we've been wearing this blue jacket and they call us the Blue Jacket Girls. So we're out in the community a whole lot more. And Asian American, we have a different culture. So before you get to the system, you got to know the people. There's a language barrier. There's older folks we're dealing with. A lot of times talking about their personal issue is a very, very, what do you call it, the taboo thing to do. So we got to become a daughter sometimes. We got to become a son sometimes. We got to be a caregiver sometimes. So Health Ambassador booth will be set up at the very front, providing survey and free screening for people who's in need of financial assistance and then behavioral mental health. And our elders suffer a lot from behavioral mental health. They do not discuss their condition with their kids because they don't want to bother the kids. About a couple months ago, a lady fell In 2 days, she died because she did not tell the kids that she fell and she hurt. She didn't want to bother the kids, grown kids. So they think if they don't have a kids live with them, they got nobody. They have us. And I realize we all go for the common goals. They want to be healthy. They want to be able to raise the kids with no drug problems. And elders want to grow older, healthier. So we will be providing those things, and Resource Fair will give exposure, what health ambassadors do, what kind of programs we offer. So we're looking forward to meet the folks in another level with the smile that you guys teach us, with the gentle gesture you guys been educating us. I'll tell you, those techniques work a long miles. Thank you so much. I hope that I see you guys out there.
Definitely see us. Thank you so much. And we have our next slide, please. We have Kingdom Care. They'll be doing a community wellness day. Do we have someone from Kingdom Care online for us?
Hi, hello, can you hear me?
Yeah, we hear you.
Okay. My name is Shanita. Hold on, let me start getting my video up here. Okay. Tiara's here as well. And we are having a community wellness day during Gun Violence Awareness Month. So we'll be highlighting community safety. We're also going to focus on access to care. We want to have a lot of different on-site services, as many as we can for the community. And we want to focus on, you know, health screenings, maternal and infant care, agencies that provide wraparound services and help with economic stability. And we're just welcoming all the support, you know, that can be provided. So we'd like everybody to try and spread the word for it, you know, help us out, spread the word. And we have a couple partners already that we're hoping to, we're trying to solidify Luminous Health now. We're working on that. The library, Black Girl Mental Health, the Black Girl Mental Health Foundation will be with us. The National Coalition of 100 Black Women is participating. Our VIP, our Man Up Anne Arundel program, they're going to be participating with us on it as well.
Awesome. Thank you. And you did not mention the Office of Health Equity and Racial Justice.
Oh, yes, of course. Of course.
But thank you for the great work you're doing.
Be
And
one of our
also,
partners as well.
yes, and also on June the 7th is Gun Violence Awareness Day. So they're linking that into that weekend. So, but on June 7th, but you'll hear more information about that as well. Thank you for the great work and thank you for planning and prepping for this upcoming event. So next slide, please. We have Growth Matters that will be one of our child partners related to the Juneteenth. That's on June 22nd. I believe Dr. Coates is online.
Yes. Hello. Hi,
How you doing, sir?
everyone. Thank you for this opportunity, and I certainly enjoyed everyone's presentation and look forward to collaborating. I'm the CEO for the Celebrate Annapolis Juneteenth nonprofit. This year, we're sponsoring the 4th annual Annapolis Juneteenth Parade and Festival and Celebration on June the 22nd. That is a Saturday. It starts in the morning with the kickoff parade of over 2,000 participants, floats, and lots of bands and excitement. And another key point is our opportunity to have our partners, you know, celebrated and all of the different many resources we have. And it will commence the parade will start at the North Calvert at Calvert Street and come through about at Foot Soldiers Memorial, come down past West Street to Amos Garrett, and it will end at the Bates Sports Complex where Maryland Hall is located. It will then we'll have feature a Battle of the Bands, and then the festival starts at 2 p.m. And the festival includes over 175 vendors and resource providers. We have a village called Watoto Village, which is Swahili for children. All the resources for children to thrive. But most important, our resource providers, Anne Arundel Health Department, Office of Equity, Luminous, Aetna, Kaiser Permanente, they all will be there, not just to have a booth, but also they will be speakers on the stage. Every hour on the stage, we will have speakers in between the entertainment. Entertainment will be national and local artists on the big stage. And the event ends at the end of the evening with fireworks from our city. And we are super excited because our community health ambassadors will be there along, hopefully with many of you, to make sure that we continue to provide a platform to talk about access to care. Mental health, which was our main focus last year. This year, it is still our focus. And the theme is called You Still Need to Talk to Somebody. This year, we're really focusing in on mental health. We're also dealing a piece on COVID and where we are in the process, because even though it's not talked about a lot in mainstream media, I think we all have been feeling the effects of COVID. And of course, weather preparedness and emergency preparedness are all part of our focus this year. We're partnering with the Anne Arundel County Office of Emergency Management, et cetera. So the information for the event is all on our website. We would love to have so many of you there, especially nonprofits, to have a booth, and any resource providers. We'd love to give you space and to really highlight what you're doing. I'll be doing some interviews from April through June with different providers to talk online about what people should look for when they come to the festival. And we have a pop-up shop at the Annapolis Town Center all of May and all of June, where we will be doing some special events to talk about the festival and to talk about all of our providers. So our information is posted there, and our link, if you'd like to sign up for the parade or as a vendor, please go to that website and scroll down and just hit the link, and it'll give you access, and our team will get right back to you. Or you can send me an email at info@theannapolisjuneteenth.org. And again, thank you. So on that there for vendors, it lists a lot of the different types of vendors that we have there each year. And it's been amazing. And last year we had attendance of over 14,000 people. So this year, each year has grown by about 5,000 people. So this year we're hoping to top that, weather permitting and all. So thank you.
Thank you so much, Dr. Coates. And we'll make sure for all of our partners for their events that you'll have their contact information if you would like to partner with them on all the upcoming events when we send a follow-up email with the dates and who will be the main point of contact. If we can go to our next slide, please. We have Mindy Garrett, who we just talked about Healthy Anne Arundel Coalition and some of our Healthy Anne Arundel events that are coming up soon.
Thank you, Raymond. I'm Mindy Garrett. I am the program I lead here at the Department of Health is the Local Health Improvement Coalition, known as Healthy Anne Arundel. And I'm going to tell you about two events that we have coming up, and I'll make a note to update my photo as well. So the first is Healthy Anne Arundel Day. This is right around the corner. April 7th has been proclaimed by the county executive and by Mayor Buckley. We have official proclamations making April 7th Healthy Anne Arundel Day. To celebrate this, we have 4 main hub events. So each of these events is a little bit unique. They are all operating as sort of mini health fairs. You saw that Ms. Kaya Vaughn is going to be providing health screenings at our first event at the South County Senior Center on April 5th. April 6th, we have an event at the Merritt Health Club in Hanover. And then April 7th, we have an event at the Chesapeake Children's Museum in Annapolis, as well as the Y in Pasadena. So spreading it out throughout the weekend. All of these events will have a food drive. This March is also Nutrition Month. So the Anne Arundel County Food Bank has a new healthy donation guide. I would encourage everyone to look at that. It's very comprehensive guide to making your donations to food drives as useful as possible for the recipients. Additionally, The Anne Arundel County Rec and Parks is waiving their entrance fees to the parks that have entrance fees on Sunday, April 7th. And we are spreading the cheer with Facebook on social media using the hashtag #HealthyAACO. So if you go to any of these events or do anything healthy for yourself, your family, your friends, your community, please share it with us and share it with the hashtag #HealthyAACO. And the next event coming up in May is Mental Health Awareness Month. So the first thing I want to tell you about is the kickoff event. This is co-hosted by the Mental Health Agency in partnership with the Center of Applied Technology North in Severn. So that event is, if you scan the code, you can find some information about that and other events happening throughout the county. That big event from 10 to 12 on May 11th, it is going to be an enormous health fair. I encourage everyone to make an appearance there. There are lots of vendors. They have some food trucks. The first 200 people to come will get tickets for some free food at those food trucks. And there are lots of good educational stuff happening throughout the day there. For a Healthy Anne Arundel Coalition, we have a social media campaign that includes a photo campaign. So we're looking for photo submissions according to the weekly focus topics for Mental Health Awareness Month. And if you go to the landing page, that aahealth.org/mental health awareness month, it'll give you a little bit more details about that. So you can submit your photos and we will be sharing them on our social media pages. We are also having a student video contest, so you can look for information for that coming up as soon as Friday, but probably not until Monday, April 1st. That's for grades 6 through 12, and there will be a gift card prize for the winners of that contest. And I realize that we're at 4 o'clock, so scan the barcode, scan the QR code for more information.
Thank you, Mindy. And what we'll do is, once again, in a follow-up email, you'll have all of the contact information for every presenter, for all of the flyers, all of the slides. So any questions you may have, any concerns you may have, you may just contact us directly. You can go to the next slide quickly, Alex. Please, inside of the chat, we always welcome you guys to fill out the survey. If you're ever interested in being a presenter and anything we may do in the future, or get your feedback from the presentations, your thoughts, your feelings are very much welcome with us. Next slide, please. And then this is all of our contact information. Once again, that has been put in the chat. Please reach out to us. If we didn't get a chance to answer your question, that would be the opportunity for you to reach out to us, and then we can go into more depth with your questions or concerns. So I'm going to turn it back to Karina for any closing thoughts.
Thank you so much, Raymond. So you've heard it here today. The Anne Arundel County Department of Health and our community partners are being very intentional about listening, engaging, and serving. So we encourage you to spread the word about what you've heard. Thank you.
Thank you, Arwa. See you on April the 22nd.
Take care.
Thank you.